So this, I also thought I was going to talk in Hebrew, but I needed 2 beers and I didn't have time, so I'm going to have to speak in English. So I'm going to talk about air pollution and the design of our cities and the links there. So right now, 70% of the world's population, or about 50% of the world's population lives in cities. In a few years, that's going to be 70%. And if you think about the growth in the world's population, all of that's actually going to be absorbed by cities. So the question actually, when we talk about environment and health and human health, increasingly is actually how do we design cities for health? We used to think about environment and health as the environment that was sort of out there in nature and us polluting that, but it's actually how do we design the places where we live and spend our time so that they're healthy and also provide all the benefits that we have in these urban areas. And Israel is actually a very urban country. You probably know 90% of the population is urban, and it's actually still slightly increasing over time. So as Jeremy told you already, air pollution's been in the news a lot this year. We've seen examples in China, very severe air pollution episodes, and really crazy things happening in China. Airports having to be closed because they can't see. Actually shutting down the whole road network because of the air pollution. People are selling clean air in bottles in China. You can buy, well, all kinds of business opportunities for you interested. And we've done some work to try and also estimate air pollution, how bad is it in terms of health. So one thing to be reassuring, for one person, any one individual, actually the risk of air pollution is rather small compared to all the other hazards that we face. But what makes it important is that everybody is exposed to air pollution. We all have to breathe, and collectively, the impacts become quite large. You can think of the contrast of this. So for example, if you use cocaine, you're about 45 times more likely to have a heart attack than if you don't use cocaine. So for an individual, that's a very risky thing to do. There may be reasons to do it, but it's a very risky thing to do. But fortunately, not that many people in the population use cocaine regularly. So for the whole population, it's actually not that big of a risk. But air pollution is the opposite. For any one person, the effect is rather small. But for everybody, everybody's affected a little bit. Most of the impacts of air pollution are on the development of diseases that we would normally be getting as we age, for example. So heart disease, cancer, lung disease, which are diseases that many of us will actually develop in our lifetimes. The question is really how much does air pollution contribute to those? It's not the major cause, but it's one cause. Air pollution has many effects. We'll think about deaths just as one example, but if we're thinking about deaths, there's actually many other things that happen to many other people. So what do we know about air pollution? We know that on days when air pollution is worse, more people die, which is really kind of amazing if you think about it. We usually think of sort of day-to-day deaths as sort of a random thing. A bunch of people died today, a bunch of people died yesterday, a bunch of people died tomorrow. But actually, if the air pollution goes up, we get differences in that. We know if you live in a more polluted city, you will die earlier than if you live in a less polluted city. So if you have a business opportunity in Beijing, you may make more money than if you live in a place like Vancouver, but you will die earlier. So enjoy your life. And in the most polluted areas of cities, so even in neighborhoods that are more polluted than other neighborhoods, you have an increased risk of dying. Jeremy mentioned this project that we did to try and estimate, actually globally, how many people die of air pollution in the world. We needed to combine a lot of methods. This is sort of a map using satellite information, using measurements we make on the ground, using a complicated model. These are levels of air pollution around the world. You can see where I live in Canada, it's very clean. In China, it's very polluted. Europe, Israel, somewhere in the middle. But actually, overall, about 90% of the world's population lives in areas where we say the air is clearly polluted to the extent that it's going to affect your health. And when we took all of these in this large study called the Global Burden of Disease, and we compare air pollution to about 70 different what we call modifiable risk factors. So these are things that we can change. There are many things that affect our health that we can't change, our genetics, our development. But things that we can change, air pollution was, I think it's the 9th leading risk factor for all disease in the world. Again, pretty amazing. I work in air pollution, and this amazes me. I still don't quite believe it. We know that there's 3 million people dying every year as a result of air pollution. Now, Jeremy mentioned 7 million. So this is outdoor air pollution. The other 4 million, it's from indoor air pollution as a result of cooking over open fires, which is common in rural areas in developing countries. So anybody who's been to India, for example, Southeast Asia, you've seen this, cooking over an open fire. But from outdoor air pollution, commonly a problem in cities and in more developed countries, 3 million deaths per year. And in Israel, it's a major problem. In Israel, it is the, I can't count, 1, 2, 3, 4, 5, 6, 7th leading cause of death. About 40,000 people every year in Israel die as a result of air pollution exposure. And again, it's air pollution contributing to these major causes of death. Fortunately, unlike many other diseases, we actually know how to solve the problem of air pollution, and we have lots of experience. So this is an example of one study. This is Dublin, Ireland. These are homes in Dublin, and you can maybe see these little chimneys. So historically, each of these homes were heated by burning coal. And over time, coal was replaced. Coal is a very polluting, heavily polluting fuel. Over time, coal was replaced with other sources of heating. And at one point in the 1990s, the government actually banned the sale of coal completely in Dublin. And what you may be able to see here is that the levels of air pollution go up and down, higher in the winter, lower in the summer. When this changed, when the sale of coal was banned, essentially all the levels in the winter dropped. What happened? A 6% decrease in all deaths. And if you look more specifically at the causes that are really affected by air pollution, respiratory or heart deaths, 15 to 10% decrease. Now this is huge. We don't have drugs that can do this. We don't have surgical techniques that can overnight lower the death by 6%. And again, this is this issue that everybody is affected, but if we make a change, everybody benefits. So here's another example, very similar to what Jeremy showed you, looking at the amount of reduction in air pollution, so how much it was cleaned up in the United States, and looking at life expectancy. Over a 20-year period, life expectancy increased by about 3 years, and about 15% of that was due to cleaning the air. You can see that there's a relationship between how much the air improved and how much life expectancy increased. There's a lot of scatter, so that means air pollution isn't explaining it all, but it's explaining some of it. So we've had some successes. Now, more recently, we've begun to understand that very, very small changes in air pollution that occur within cities that relate, in fact, to the level of exposure or how close you are to actually major roads also lead to a risk of dying in many other diseases. And we can develop very detailed high-resolution maps where on the order of meters, we can identify whether the air pollution here is dirtier than it is over here. And in our studies, these are just some studies we've done in Vancouver. We've shown this relationship with low birth weight, with infant respiratory disease, with things like ear infections. Ear infections actually start as a respiratory infection. And any of you who have seen a young child with an ear infection, you know it's really painful and you want to run away because the child is screaming. Very painful. Heart disease deaths, lung disease, lung cancer, and even developing asthma. And asthma, we've actually looked at the genetics involved in as well. And we know that people with certain genetic profiles are the ones that are affected. because they have differences in in the genes for one of the enzymes that actually detoxifies some of the air pollution that you can inhale. Here's a study that we did where we actually were able to follow the whole population actually of Vancouver where I live. So about, these are looking at adults over 45 years of age, about 500,000 people that we followed. And we had the ability to actually see if people had moved from an area where they were close to a major road or moved away from a major road. And then subsequently, what was their risk of dying? So we know actually if you live close to a major road during this whole period, you have about a 60% increased risk of dying from heart disease as an adult. But more importantly, if you started out living close to a major road and moved away, your risk dropped almost the same as people who never live close to a major road. So this is like quitting smoking. You're quitting pollution. And in this case, people were quitting the pollution by moving away from the road. So that's something that some people can do. Not everybody obviously can move just because of the pollution, but maybe we can move the pollution away from people. So here's an example in Munich. What they did was they took that road and they tunneled it, and they can actually filter the air pollution. They made a park on top of it. What does this do? Well, so now you took away that pollution source. Actually, the traffic was not affected at all. You created, I'm not touching anything, right? The traffic was moved away. You actually created a linear park where people could cycle, run, actually get physical activity that's good for them. Housing values increased. There was actually new land to build, and because you're right next to a park, it was very expensive housing. So it's just good for everybody, and it actually improved health in the area. So coming back to these causes of diseases in Israel, I mentioned air pollution was number 7. Number 6 is actually physical inactivity, not getting enough exercise. And actually that's something that many cities now are thinking about when they develop design plans or think about building new developments, is how can we actually design a city to encourage people to actually use physical activity instead of just getting in their car. Can we convince people to walk by designing a city? And we actually know if we design cities so that they're easier and safer for people to walk or ride a bicycle, that they will do it, and it actually leads to improved health. So here's just an example looking at the design of cities, and we see that if you design cities so that they're more walkable, as we call them, people will walk more, their level of obesity actually goes down, and a number of other health measures improve. So we can actually map walkability. We know what factors actually predict whether or not people will walk. And it's things like, well, I don't know, any ideas? What would predict whether a part of a city is easier for people to walk?
How steep are the sidewalks? Terrain.
So traffic, sidewalks. The what? Hills, yeah. Weather, well, yeah, weather is not going to change from parts of the city, but so those things. So can people walk, right? Sidewalks, are the streets, you know, going crazy like all over, like in Haifa, or are they straight? Are there places for people to go, right? If you know, if it's a mall you have to walk 5 kilometers to get inside the store versus a store that's right here and I can walk into. That makes it easier. So we actually know these factors, and we can map them. And what we can do is actually combine these, for example, with our maps of air pollution. And we did that. And there's some interesting challenges here. So actually the places like this, so this is in Tel Aviv, this is in Vancouver, the places, these are very walkable places. And you can actually, there's a website that actually you can look at anywhere in the world and you can see how walkable it is. And this is actually now used. So we know that the places that are actually more walkable, they're actually places with more traffic because they're places where people want to go. And historically, we've designed cities so people can get there by car. And now we need to think about redesigning them so people can get there without going by car. So what we did was actually took one of our maps of air pollution, combined it with the maps of walking. And what you can see is actually the green areas are places that are easy to walk, good for walking, and also low air pollution. The red places are places that are bad for walking and bad for air pollution. The white places are places where it just cancels it out. It's good for one and bad for the other. And actually most of cities, I am not touching anything, most of cities are actually cancel each other out. And this is quite common. So I won't go through the examples, but this presents a challenge for us. And we actually can see in some studies that the benefits of designing places for walking, for more physical activity, are actually canceled by the air pollution that's higher in those places. So we need to be a little bit smarter about designing these places. Other things that are similar also because of transportation are noise. And actually, you may be surprised to know that noise also leads to heart attacks. It's also a risk for heart attacks. It's also very annoying and actually can have other impacts if noise at night, for example, disrupts your sleep. So noise and air pollution, we've actually combined the two, and we can find that, and it's surprising that actually the places that are noisiest, even if the noise is coming from traffic, are not the places where the pollution from traffic is the same. So you can imagine, for example, when a car makes the most noise, it's actually when it's going fast. When cars are actually stopping, that's when they make the most pollution. And even the design of the road surface, actually. So it's not completely balanced. So again, but what we can see is that both of them have effects, in this case, on heart disease deaths or on the birth weight of babies. There's also been growing interest in research on green space. How many trees or how much blue space, how much water is in a city? This actually seems to be beneficial for health. So the fact, if you live in a part of a city that has more trees or more parks, grass, green, that seems to lead to better health. Why is that? That's a complex and open question that I don't think we fully understand. But what we can also see is that we can map this. Again, this is using satellite estimates. And even after controlling for air pollution, noise, how walkable an area is, after taking out all those negative impacts, green space still has some protection. So it counteracts against the negative effects of those other things. So it gives us some clues, perhaps, on how to design healthy cities. So what do we need? We need to think about clean, green or blue cities. They ought to be quiet, but they can't be boring because nobody wants to live there. So they have to have things for people to do, walkable, bikeable, as well as the other things that many of us actually think about routinely. Is it safe? Is it friendly? Is it convenient? Can we afford to live there? So thank you.